Yeah, they can come in. Hello.
Hi.
How are you all?
Good, thank you.
Thanks.
How are you?
Take a seat. I'm Prima. We are going to talk about, learn about taking pulse today. So would you like to introduce yourself?
My name's Jasmine.
Jasmine.
I'm Grace.
Grace.
Stephanie.
Stephanie, yes. So can I start by asking why are you doing this course at the moment?
I have always kind of been a little bit interested in different aspects of nursing, but I'm not a nurse myself, so it's just further education and expanding my knowledge on these things. I work at a pool, so we do have a lot of people fainting sometimes or getting lightheaded, so it'd be nice to understand a little bit more about reading pulse and making sure that I can check on them and things like that.
That's very good, Jasmine.
Thank you.
And you?
So I guess I am a nurse, so I guess this kind of session will reinforce any knowledge that I have.
Ah,
Yes.
right. That's good.
I'm a first year nursing student.
Yes.
I'm just trying to get ahead of the curve so I
Yeah.
can be that little smarty ass.
That's very good.
Extra credit and everything.
Yeah. All right. I hope you all received my email.
Yes.
And it says how you come, you can park in the outside the car park and things like that. So you all came by car or?
Yes.
Yes.
Yeah, public transport is just nearby too. So before I start, I would like to say something about acknowledging this place. Like, I would like to acknowledge the traditional custodians of the land which we are meeting today. And I would like to pay my respect to elders past, present, and emerging. All right. Before I start about pulse, I would like to ask you, what do you know about checking pulse? Do you know anything about it?
Nothing.
Nothing.
Absolutely.
How about you, dear?
I guess I know you should check it for 60 seconds.
60 seconds.
I think there's multiple places you can test it.
Exactly. So, pulse, when you say pulse, your body has, wherever you can see a pulse is where the blood passes through, especially in an artery passes a bone, that is where you can find a pulse. So you can find a pulse in different portions of our body. One place is your arm, where the wrist is, so where you find a radial pulse. And there's another one you can check on your neck, that is where the carotid pulse is, and there's one on your foot also. But usually, because it's the first time we are learning about the pulse, today we are going to learn more about this radial pulse. That's what I'm aiming to teach you today. All right. Before I wanted to start, I would like to show you a few things about pulse. Just a second. So this is going to be our roadmap for today. So you three can see it?
Yes.
Okay. Yeah. So after the introduction, and then we are going to talk about the safety and emergency in this area. Then we'll have some discussion about how to check the pulse, and I'll show you how it is. And after that, we will have a demonstration. Then you practice, because we need to practice each other as well as I can show you. Then we will have an assessment how you people are doing or assessing the pulse. And then we have an evaluation and a feedback. So is that what it is today mainly going to be? All right. Before I start about the safety today, because we are meeting in this place, it is called the ABC training. So here, as you walked in, on the right side of the door, if you turn to the left, there is a toilet and there's a kitchenette next to the room after that, if you want to make any cup of tea or anything like that. Other than that, because we are meeting in this ABC training center, we have a first aid officer who is sitting next to the reception. So I have these phone numbers which I have left it on the paper here. So in case of emergency, we have it here. And there is a map also attached to it, the building map. In case of emergency, I will be leading you out to the place where we have to go and meet. So that is mainly about the emergency. And toilet, anytime you feel free to go, you can always have a break in case if you want. Otherwise, I'm expecting this section to last for 30 minutes. So that's what's happening today. So, checking pulse, as you can see the picture here, This is what the radial pulse is, which we are going to talk about more today. So, talking about the pulse, pulse is the heart rate, symbol as we talk about, which I'm hoping you all know that. And then this is when you feel the pulse. How you feel the pulse is when the blood circulates through the surface of our skin. Wherever the artery crosses a bone, you can feel the pulse, as I said earlier. But your pulse is measured in numbers, that is per minute. So how much blood is circulated through your heart, that is what you are feeling it. So sometimes you can say that the pulse, when you check pulse, you will find that in your wrist, you count each, that's like a beat it goes through or it's pulsating through. So when you feel it, when you start to do it, you will understand how you can feel the differences. There are few different types of when you feel the pulse, there are irregularities you can find about it. Sometimes you can find the rhythm as well as the other characteristics, like whether it is very strong or whether it is weak. Depending on that, you can understand the person's cardiac health also. Like as you said, you work in a pool. If a person collapses, what you will first thing you do? You check for the signs of, whether the patient is alive or not. So what you do is really checking whether the person is okay. So one of the main thing is, one of the vital signs is checking the pulse to know the person is alive or there is some signs of life in there. Yeah, as you said. So that is what it is. So you feel the force of blood going through the artery close to the skin surface. Okay. For example, we say the pulse is, we check it in like in the minutes. So there are few steps how to check the pulse. So how do you check the pulse? That's the next thing. So because I'm talking about the radial pulse, you need a watch or a stopwatch to check for 1 minute, because you're checking the blood circulation for a minute. So it is beats per minute. So the pulse is checked, you need a stopwatch or a watch for that. So when you check the pulse, you check the rhythm of the pulse also. Like when you press it, you can feel it, whether it is regular or is it is happening like a missing beat in between, or you sometimes see that it is too fast and then it stops. So there are few things which can happen, like irregular rhythms, so any problems with the person's cardiac health, you will see difference in there. So today when we learn how to check the radial pulse, mainly we are going to use the 3 fingers or 2 fingers. We never use the thumb because our thumb already have a pulse. So you may not feel the pulse, you may be feeling the pulse of the thumb. So mainly you're going to use the middle 3 fingers. So when you ask a person, make sure you look at the person's wrist. So ask the person to show the wrist. There are few things which can affect our pulse. Things like if the person is standing or sitting, the position can affect the pulse rate. Same way the age of the person. If you are going to look at an adult, it is going to be the normal beat for the heart, it can be 60 to 100. But if it is an infant or a child who is below 15, then it can be a bit more faster. And a person who does exercise, you can think that the heart is going to beat more. So a person come back from walking or a person sitting down for too long, the pulse rate may be different. So you always have to think where you are going to do the pulse. The positioning is more important. The same way I would say, ask the person to sit down or stand up for a while. You can sit next to the person or you can stand next to the person while you are checking the pulse. That's one of the steps. Then to locate the artery, where we are going to find the radial pulse. To locate the artery, you look at the person's arm and always make sure the artery comes next to your thumb, where your thumb is, and you put your hand on around this area of your arm and come towards the artery. You will find a bump slowly there. Are you able to find it? Yours, all of yours? And when you see there is, if you put your hand like that, you can see there is a small bump, and that's where you feel your pulse. Are you able to find it? Any of you?
Here.
when you go to the person's arm, just come here where the thumb is connecting, and you will find it. Yeah, I can feel it exactly here. Just see whether you are able to find it.
Yeah.
You can see mine is more obvious if you try here.
Oh, yeah.
Yeah, yeah. Are you able to find it there?
Yes.
Can I try?
Yeah.
Is that where you find it?
About there, I think.
Yeah.
Yeah.
Are you able to?
Yeah.
Yes. How about you, dear?
Yeah,
You find it? Where exactly it is?
where the red marks are.
Yeah. Yeah, that's where you find yeah. Are you able to find
Yeah.
it? Yes, that's where we find our pulse is. So mainly make sure the person's arm is free, clean, because if some cases like people who had a surgery, they may not have an artery there, it might have been removed. In that case, you look for the area, whether there is any mark there. That means, or you can ask the person, because usually they know that they don't have a pulse there. So then you look for the other arm. That's what it is. Okay, it's always easy. If you have a jewelry or a watch on your arm, you need to remove it. Some people may be wearing a gloves, you need to ask them to remove it. Yeah, you're
Yeah.
able to find your
Yeah.
pulse? That's good. So, once
It's working.
once you locate your radial artery, that's the main step in finding, checking the pulse of a person. Alright, that's good. Next one is applying gentle pressure, which you already done it, so you know that how it is done. Okay, now the next step is counting the pulse. So for that, I can give you my stopwatch, or we can put
I can use my phone as well.
yeah, all of you can. For 1 minute, we are going to check and count all of your pulse. Are you able to locate your pulse? Yeah. Are you able to?
Yep.
Yes. So we are going to start our watch now. So for a minute, you count. Every beat, you count 1, 2, 3. You can see it. Tick tock, tick tock, tick tock. That's how it comes. Okay, start now. One minute. What is your rate you
I
got?
got 92.
92. Oh, that's good. How much?
78.
78, very good. 63, that's good too, because for an adult, it can be anywhere from 60 to 100, especially you are sitting down.
Okay.
You're not doing anything, you are in a resting. For an athlete who is a really strong athlete, resting the pulse can be below 60, which is natural, normal. But for a person who is running and coming and checking, you will feel your pulse going up and down. So it's natural. I have some, paper handout about how to check the pulse, so you can see that. So that's how you count your pulse exactly. So when you do the assessing the pulse, you also assess the characteristics of your pulse. What did you find your pulse as, Jess?
Pretty consistent.
Pretty consistent?
Yeah.
Did you feel any irregularity or beatingness?
No.
No.
Thankfully.
That's very good. How was yours?
Mine was regular.
Yours was regular too, very strong.
It wasn't super strong, but
No.
it was regular.
It
yeah.
was regular.
Yeah.
Sometimes it can be a bit weak, sometimes
Yes.
you can miss a beat. I don't know. So this all shows depending on the person.
Yeah.
Usually missing a beat or even having bit of this not the same the rhythm, it can be normal. Some people are like that. But if you see it regularly or you are feeling your heart, like sometimes you can see that you can feel your heart, like then it is a time you have to go and report it or find it. Make sure you get the medical assistance. How much was yours?
I can't remember what I said now.
Was it
I think
17?
70 something.
Yeah.
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 Was it very strong?
Yes, yeah.
And was it going in rhythmatically?
Yeah, it was very
Tick-tock,
regular.
Tick-tock. That's
Yeah.
what they say. It should go like tick-tock, tick-tock, tick-tock when you feel it going up and down, up and down, up and down, up and down. All right, that's it. It's not only assessing the pulse, you need to record it also, which is also part of our job. So make sure once you know, learning pulse is, learning to check the pulse is a bit difficult, but as always you remember, you use either the 3 fingers or the 2 fingers, and make sure you always check it. Don't press too hard. If you press too hard, you are going to press the artery down. Then you are not going to feel that pulsating feeling. At the same time, don't use your thumb. Always 2 fingers or 3 fingers. Most often it's the middle finger or the index finger. You can feel it really well. Just is finding.
I know it's good.
It's good.
Yeah.
You sure?
Yeah.
I know mine. If you want to feel it.
No, it's good.
It's good. It's good. Yeah, that is how you do your pulse. Yeah, counting the pulse, assessing the rhythm and the pulse. Yes.
If it was weak or not very strong, what does that indicate?
It doesn't indicate anything. Sometimes what happens is some people are born like that. They can have a missing beat, like when it goes tick tock, sometimes it does miss a bit. Sometimes you can see it keep going. There are few heart problems like the arrhythmias and other problems which the heart has. It can be one of the indications for that. But it doesn't affect you normally if there is a missing beat or the rhythm too weak or. But if you keep finding it that, or if the patient is in the hospital and you are in the hospital setup and you are finding it really irregular, then of course you need to report it. And if you think for an adult, usually it should be within 60 to 100 in a hospital setup. And if you think it is below that, as long as the patient is very healthy and not an athlete, then it should be reported because there should be some reason for that. Cardiac patients, definitely, yes, there is a reason for it, then we will. But at the moment we are not cardiac nurses, so we are not going to use it. We will be just learning to check the pulse. So basically, this is how we check the pulse, yes. Okay, often an irregular pulse is harmless. There is nothing to worry about it. Some people have palpitations, which is like too fast. Sometimes it can be too slow. That is called palpitation. It's another condition. But most often, they can be managed. Sometimes certain medications, I think it can cause your heartbeat to have a different heart rate. Sometimes the heart beat different ways because you are on a certain kind of medications. So there are things like that we need to consider when we check someone's vital signs. But in case, like a swimming pool setup or somewhere the person you see then collapsed on the floor, you don't know anything about that person. The main thing is check whether the person is alive or not, other than you checking whether the person has the ABC or the CPR. You always check make sure the pulse is back. That's what it is. That shows that the person is alive mainly. And another thing I would like to say is if you're self-checking the pulse, you need to check it in the same time of the day. Not that exactly on the time, but if you usually check it in the morning, you have to check it in the morning. But also the person is resting for a while. You don't check immediately after coming back from a run or a exercise section, things like that, yes. And when you start doing the pulse, you always do for 60 seconds or 1 minute. That's how it is. So once you get learned very well, you can take it for 30 seconds and then you can multiply into 2 or that will be for 1 minute. But that's only when you become very proficient, you know very well how to check the pulse and things. So I would like to show you some of the steps in checking how to check the pulse again, just to remember it one more time. So if you have a look at it, so this is how you ask a person's arm, and make sure there is no watch or jewelry or anything there. And you always use 3 fingers, same way I was talking about the 3 fingers. And make sure you come to the, as it says, you place your fingers alongside of there and you will see the rise and fall, or where the artery crosses the bone, you will feel it. and count. Use the stopwatch to go for 1 minute and check it. That's how usually you do checking the pulse. Anybody have any doubt about it? Okay, I would
I
like
always
you to.
thought it was like a vein thing, but no, apparently
No,
not.
it is actually where the bone crosses the
Yeah.
artery. That's where you can feel it. Exactly. Yeah.
There
And
you
if
go.
you
Oh, I
put
just
it
brought up a
there.
calculator. Yeah.
Yeah. It's very easy if you know it. The steps are very easy too to do it. So would you like to go and check each of yours one more time for me? And don't press too hard. Just make sure you check it and just let me know how much is. Always make sure we have to report if there is any difference in the heart rate, as well as, yeah. Do you want to go? I can put the watch for 1 minute. You all want to start it? Yeah, you already started. You want to start? Yeah. Yeah.
Two.
You got it 62.
I got 85.
85.
Yeah, I got 80.
80. That's fine. As long as we all are within the normal range,
Yeah.
it's okay. It depends on many factors. If it is a too hot day also, it can affect our, body temperature can affect our heart functioning. Sometimes the heart can function beat very fast if it is too hot. Like I'm from India, I know when it is a very hot day, you can feel sometimes if you're not hydrated enough also, you can feel like. So it's more important to make sure you know to check the pulse as well as to report it, yes.
Does that
Did you
mean
find
I've
it?
done it too hard?
Yeah, that's why it is
Okay.
getting, yes. In my skin it doesn't show, but yes, yours, yes. If you're pressing it too hard, it's going to.
Okay, I'm
Yeah.
sensitive skin.
Any doubt about it?
No.
No? It's clear?
Very clear.
Will you be able to practice when you go home? You can self-practice it. Don't get alarmed if you see different reading. Of course, the heart is not going to pump the same amount of blood every time you check it. Okay. Okay. Now we would. Any more doubts you have?
I wouldn't mind if I could practice it on someone else.
Yes. You want to practice on me?
Yeah, I think I can
Yeah.
practice on you.
Yeah.
Anyone practice
that's
on
good.
me?
I can
Yes.
practice on you.
Why not?
Which hand do you want?
I don't know.
Do you want my right arm or left
Sorry,
arm?
I'm
You
going
can
to
choose.
put
Go
this
this
one
one, it's
at-
right
Yes,
here.
that's fine.
around here. Right. I can feel it. So in 30 seconds, got 42, so that would be 84.
Yeah.
Doing it the quick way.
Because you're really proficient.
73.
I'm so qualified.
Yeah, I think I'm still alive.
I think you might be alive too. It felt nice and
I'm
strong and regular.
Yeah. So it's very easy here. It's good. I'm sure you
Yours
like
is
very well.
strong.
Oh yeah?
In comparison to what I felt on mine, I was about to do it on mine again.
Is this strong?
I can feel it. Yes. Don't worry. You're
No, okay.
fine.
64.
Ooh.
That's very good. It's good to practice 1 full minute when we start to learn it. And when you are practicing too, you have to. And always make sure, depending on where you work, you have to record it immediately after checking it, of course. And if there is any irregularity, really right changes in the reading, then you need to report it to the, always make sure you report it. So that's mainly it is today. And I would like you to have a read about it in our policy and procedure, especially when you go and start to work in some places. They have their own policy and procedure on reporting the, if there is any changes, as well as how to practice checking the vital signs. It's part of vital signs, of course. What else I would like to explain? If you have any doubt about what we learned today, I will send you the link. Make sure you have a look at it, and also the policy procedure in the pop water also about checking the pulse. And this is mainly, remember, it is the radial pulse. It is not the other pulses. It's only the radial pulse we learned it today. These are the steps. Always make sure you check the person's arm. Make sure the pulse is available on that arm. That's no surgery or nothing happened. And make sure the arm is clean, and find exactly where the artery is located. Make sure you use your 3 fingers or 2 fingers, not the thumb, and locate it, and make sure you press it gently and feel the tick tock going. All right. It may not be always tick tock, tick tock, tick tock. It can be a bit of a missing beat, or sometimes it can be. It depends on the person's health condition, of course. And always you need a stopwatch or a watch to check the 1 minute. That's another thing you need it. And if you have any other doubt, please feel free to contact me. My email, as I send it to you, you all have it, as well as read about it. And the World Health Organization site is there, as well as the place where you work and in the pop water.
Awesome.
Okay, we have this evaluation form about the class. You feel free, please make sure you finish it. And after finishing the lesson, you go back to the same way and we'll do it. All right. Thank you. Any more doubt, anything?
No, it's great.
Okay. Please do the evaluation form, and then we'll go about it.
So you talked about other areas. You talked about the foot. Where on the foot do they do it? That's interesting.
Yes, there is one of the artery. You can find it on your foot also,
Yeah.
the pulse.
That's
Wherever the artery crosses a bone, you can
Yeah.
feel a pulse. So one of that one is on your foot too, because sometimes you have problems with your arm, or sometimes the person had a surgery, or if it is a major accident zone where you have to check the person, and the person's arm is not available, then what you are going to do, isn't it?
Yeah.
Do you have any experience in that, checking someone's, or have you seen it somewhere?
Well, I've done it once on placement, but
Yes.
we're only first year, so we do it kind of on each other. But having it out there in the real world is just not something I've done just yet.
Yeah, that's true. Yeah.
So I was just interested.
I dislocated my foot once and they checked it on my foot.
Okay,
I'm
yeah.
assuming to make sure that I still had blood going to it.
Yes, that's
Yeah.
right. That's right. If there's no blood flow to your other, especially to the lower extremities, you can be in big trouble.
Yeah.
You need to chop off your leg
Luckily
or
it was
something.
okay. Not
That's
take
right.
that.
Yeah.
Well, let's hope we don't have to chop your leg off anytime soon.
Yeah.
Please.
That's true. And always make sure you practice at home. You can self-practice as well as, you can practice on your family members.
Yeah.
Also, yeah. And always remember, you may not be able to do it on small kids, infants. That is, the rate should be higher because it may not come, it will be more than 100 beats per minute. And never check it when you're coming from, exercise or something. You always make sure the person is ready.
What else can cause changes in your pulse?
Oh, there are things like emotions.
Yeah.
If a person is very stressed in a condition, that can cause changes in the pulse, heart rate, because you can imagine when you are anxious or very anxiety person, or person mental health issues, the person may not be, may not be able to check the pulse in that time, or the patient is very anxious, you won't be able to because, And body positioning sometimes can also cause changes in the pulse.
Mm.
Yeah.
Oh, that was very
Alright.
interesting.
Yeah.
Thank
Thank
you.
you.
Thank you.
Thank you.
Thank
Have a
you.
good day.
We will.
I think that one's yours.
Yes, thank you.
Um,
Thank you.